Good afternoon, everybody. It's once again Ted the Speed Learner. This is Healthcare Bill part number 26. And for those of you who are interested, number one, the reason I have the camera like this is so I can read directly off the screen. I did pull this off from the U.S. government website. It is a 900-page bill, okay? And I'm just reading this to you the best way I know how, and translating this to you the best way I know how. So this directly came from the U.S. government. They have it on their website, and you can go check it out for you if you want. If anybody wants to know where to find it, just let me know, and I will directly tell you what to do, so on and so forth. But let's just get right down to the brass tacks here. We are dealing with Section 1103, immediate information that allows consumers to identify affordable health care options. Okay, so that what they're trying to do in this case is tell you where you're supposed to go to find affordable health care. Okay. Section A talks about internet portal to affordable coverage options. In other words, the U.S. government is trying to set up a website in this particular part of the bill which would allow people to find this affordable health care coverage. It is to be immediately established. It was supposed to be established no later than July the 1st of 2010. The Secretary of Health and Human Services was supposed to, and I presume he already has, he was first to consult with the states. Okay, so in other words, he picked up his phone, he talked to each one of the 50 states and said, hey, we need to set up websites for your citizens to tell them where to find affordable health care. Okay? And he was to establish a mechanism, including an internet website. Probably he was supposed to have either an 800 service or maybe a brochure type thing where you could send out, but mostly it was to be internet, okay? Through which a resident of any state may identify affordable health insurance coverage options in that state. Now the thing is that he had to really do this over the internet because let's say you were living in one state and you had to move to another state and you had to change your health care coverage because you're moving to another state, then you'd have to find information out for that state, wherever you were going to. Okay? Connected to affordable coverage, an internet website established under paragraph 1 shall to the extent practicable, I don't know what the heck that word is, provide ways for residents of any state to receive information on at least the following coverage options. Okay? So when you go to this particular website, you're to find the following things. Health insurance coverage offered by health insurance issuers, other than coverage that provides reimbursement only for the treatment of mitigation. Wow. You talk about some language here. Health insurance covered Boy, I'm going to try this again. Health insurance coverage offered by health insurance issuers other than coverage that provides reimbursement only for the treatment or mitigation of a single disease or condition or an unreasonably limited set of diseases or conditions as determined by the Secretary. Medicaid coverage under Title 19 of the Social Security Act. So if you want to go to the Social Security Act and look up Title 19, you'll find the Medicaid coverage there. Coverage under Title 21 of the Social Security Act. So again, you would go to the Social Security Act, you look under Title 21. Now the thing is that probably what they're saying here is they don't want redundant information, so they're saying to you, okay, if you want to know about Section 19 or Section 21 of the Social Security Act, you need to go to their website and don't go to this one that's providing affordable health care coverage. A state health benefits high-risk pool to the extent that such a high-risk pool is offered in such a state. So probably in this case it would mean that there will be a separate website that will talk about the high-risk pool that I was talking about a couple of videos ago. Coverage under a high-risk pool under Section 1101, so that one will have its own website, okay? And that's pretty much what I'm gathering here. Alright. Enhancing comparative purchasing options. Okay. what they're trying to do is give you the ability to compare coverage between different companies. Not later than 60 days after the date of the enactment of this Act, the Secretary shall develop a standardized format to be used for the presentation of information relating to the coverage options described in subsection A2. Now, what he is saying to you is, he doesn't want one company saying, well, the disease is called this, and then another company saying, well, the disease is called that. So, let's say that one company was calling a disease muscular dystrophy, but then this other company decides to list all the various things that muscular dystrophy actually covers. Well, now he wants it all standardized. If one company calls it muscular dystrophy, the other company has to do the same thing. If one company calls it heart disease, the other company has to call it the same thing. That kind of thing. Alright, and the Secretary is going to develop the standard, and every healthcare provider, these health insurance providers, have to go by that standard. Alright, such format shall at a minimum require the inclusion of information on the percentage of total premium revenue expended. Sorry, wow, this is some real funky language here. Such format shall at a minimum require the inclusion of information on the percentage of total premium revenue expended on non-clinical costs. Now, non-clinical costs would be administrative costs. How much of your premium is going to go to pay for the guy who's reading through your medical forms, the customer service representative you're talking to, so on and so forth, the guy who actually runs the healthcare coverage type thing. Alright? Wow. And you can refer to this under Section 2718A of the Public Health Service Act. So you look up Public Health Service Act, you find Section 2718, and these non-clinical costs will be explained in more thorough detail. Whew. And I'm not going to do it. If you want to do it, you can go right ahead and leave a video response down here below and let us all know. We'd love to hear from you. So I'll repeat that again. We're talking about Section 2718 of the Public Health Service Act. If somebody wants to go ahead and look up the Public Health Service Act, look up Section 2718A and leave a video response down below. You are more than welcome to do it. I'd love to hear from you. Alrighty. The information that has to be on this website not only has to talk about the non-clinical costs, but it has to talk about whether you are eligible, whether the plan is available in your area, the premium rates, and cost sharing with respect to such coverage options, and be consistent with the standards adopted for the uniform explanation of coverage as provided for, and here is another one, Section 2715 of the Public Health Service Act. So you look up the Public Health Service Act, look up Section 2715, and you look up the cost sharing, and whatever that section tells you about cost sharing, that has to be on the website. So every company that provides you health insurance from now on has to tell you what part of the cost they're going to pay and what part of the cost you're going to pay in accordance to Section 2715 of the Public Health Service Act. Whew. That's a load of, yeah. Use of format. The Secretary shall utilize the format developed under paragraph 1 in compiling information concerning coverage options on the Internet website established under subsection A. Authority to contract. The Secretary may carry out this section through contracts entered into with qualified entities. So in other words, if some company wants to be a part of this kind of a website, then they have to conform to the Secretary's rules. Alright, wow, that's a lot of words. Basically what they're saying here is when they list the coverage that you can choose from on this particular website, they have to show you whether you're eligible or not, whether the plan's available in your area or not, your premium rates, your non-clinical costs. In other words, how much of the money that these companies are going to gather premiums from you, and they have to show how much of that is going to be used towards the guy who's running the program, the person you're talking to. You know, you're talking over the phone with a customer service rep. They have to show how much that cost goes to them, so on and so forth. And also they have to show on this website how much the health insurance provider is going to pay, and how much you're going to have to pay on this website. Okay, you get the pretty much idea. I will tell you more in a future video, so stay tuned.